Hello everyone. Thank you very much for inviting me this UN DESA expert group meeting, Building Forward Better for Older Persons Post-COVID-19. My name is Yuka Sumi. I'm a medical officer in Aging and Health Unit in WHO headquarters. I'm a focal person for COVID response for older people in WHO. Today I'd like to talk about impact of COVID-19 on older people and then report on the WHO technical meeting we had in October, learning from COVID-19 to strengthen care for older people, including management of care for older people with COVID-19, essential services, and long-term care services. And then finally, I will touch on care for older people after COVID-19. As of 23rd February 2021, globally, there are more than 110 million confirmed cases and 2.4 million deaths due to COVID-19. Based on the case report forms with recorded age and sex, as you can see in the left graph, confirmed cases are more in 15 to 64 years age groups. However, you can see on the right graph, majority of COVID-19 death occurs in older people aged 65 years and older. 8 out of 10 COVID-19 deaths reported in older people aged 65 years or over. COVID-19 disproportionately affected long-term care facilities worldwide due to many factors, such as residents are advanced age and have much mobility. They may present atypical symptoms such as delirium, loss of appetite, diarrhea, which makes difficult to diagnose COVID-19. Many long-term care services require close proximity, and there is a difficulty to implement infection prevention control measures due to lack of PPEs, lack of training of staff. And then the environment makes difficult, for example, to isolate suspected COVID-19 cases. Most countries with large numbers of long-term care facilities are experiencing a greater than 50% rate of their COVID-19 death within long-term care facilities. 1 in 4 individuals infected in long-term care facilities died from COVID-19. More data and research on functional, biological, environmental, and socio-economical factors is required to understand risk factors and identify vulnerable populations. Long-term effects of COVID-19, so-called long COVID, or we call it post-COVID, gets more attention recently. COVID-19 can result in prolonged illness and persistent symptoms, such as fatigue, exhaustion, cognitive dysfunction, anxiety, depression, shortness of breath, coughing. This can happen even in young adults and also those with mild symptoms. These are symptoms or complications that can happen potentially a month after, 3 months after, or even 6 months after. Much is still unknown about how COVID-19 affects people over time, including older people. More time, data, and research is needed to understand what is the long-term effects of COVID-19, why symptoms persist or recur, how these health problems affect patients, and what is the clinical course and likelihood of full recovery. In order to understand more on this post-COVID symptoms, Global COVID-19 Clinical Platform Case Report Form for Post-COVID Condition has been published recently. WHO held technical meeting Learning from COVID-19 to Strengthen Care for Older People in October last year. 110 experts from all regions, including health workers, social care workers, policymakers, researchers, academics, and civil society organizations, joined the meeting. The objectives of the meeting were share experience and lessons from the current COVID-19 pandemic on care for older people, and draw on experience to identify gaps in health and long-term care services and systems in order to provide better care for older people. What is the care for older people with COVID-19? Person-centered assessment and care, including identifying atypical symptoms that I mentioned before, and assessing functions and underlying conditions of older people with COVID-19, requires multidisciplinary approach and capacity building of healthcare workers. For example, healthcare workers need to know delirium can be a symptom of COVID-19, and how to communicate with people with dementia, and how to monitor COVID-19 symptoms of older people. Accessible information, communication, and education for patients and their family, and psychological support for caregivers are key to provide appropriate care at home. How about essential service for older people? WHO surveys show that essential health services have been disrupted, including non-communicable disease management, mental and neurological services, around 70%. Comprehensive assessment and management of needs of older people, including access to foods, medications, essential supplies, mental health and well-being in the community are suggested, especially those who live alone, socially isolated, or those who lost somebody recently. Priority actions include allocate adequate resources, adapt service provision for safe delivery, including medication delivery, strengthen the monitoring of changes in availability, delivery, and utilization of services. Telemedicine or telehealth has been highlighted during COVID-19. However, practical application of telemedicine or telehealth and helplines for older people as mitigation methods to be documented and analyzed. There might be an issue of digital literacy or internet access. Older people are considered as priority group for COVID vaccines. Reaching and ensuring the uptake for COVID vaccines for older people will require different strategies, customized with local context, including an effective vaccination campaign. Community-based learning on COVID-19 with local residents is effective to reduce fear, stigmatization, and misunderstanding. Palliative care and mental care for grief and loss require more attention. How about long-term care for older people? Civil society organizations, volunteers in the community, professional associations can play a critical role to provide and implement measures for COVID-19 in long-term care facilities. The importance of extensive testing for COVID-19 in long-term care facilities, emergency funding for long-term care services, use of information and communication technology and health technology, and universal health coverage for COVID-19 related diagnosis and treatment were highlighted. Use of telehealth for education and management of non-communicable diseases in the community can be feasible, including medication delivery. Develop business continuity plan for long-term care services requires collaboration and integration within community. Needs for systematic support and investment for older people with long-term care services needs and their family in the community were highlighted. So what will be the care for older people after COVID-19? We would need to emphasize on person-centered, comprehensive, and integrated services at the clinical service level, such as using existing tools, ICOP tools, with coordination at the national policy level to achieve effective, sustainable, and equitable provision of health and long-term care. The further integration of mental health care, non-communicable disease management, and adult immunization are suggested. Concrete support and training for caregivers to maintain their health and well-being should not be neglected. More consideration to be given to providing palliative care within health and long-term care services. Long-term care services consider the need to prevent social isolation of older people that link to decline in physical and mental capacities. Building on the endorsement UN Decade of Healthy Aging, this is the opportunity for collective actions with diverse stakeholders to advance better care for older people. Thank you very much for your attention.